Contribute.
Yeah.
I was thinking it's like contributed.
I need to remember. Healthcare is blah blah blah. Okay.
Oh. What am I gonna say?
It's recording.
Oh shit. Okay. Good afternoon. We are Group 6 for Section 1 of Economics, Health Economics, and we are going through the U.S. healthcare reform and the international perspectives. So the questions that we were assigned are: what do Europeans mean when they talk about solidarity? What do their systems reveal about alternative models of capitalism? Comparing the three systems, does each healthcare system consider it a cost or an investment, and why does this seem to differ across countries? So just an introduction about the case. The case discussed how the United States ACA, or Affordable Care Act, compares to Germany or the United Kingdom's healthcare systems. In addition, it compares and contrasts the healthcare systems based on history, value, and provision of care. So what do the Europeans mean when they say solidarity? So just the general definition of solidarity is unity or agreement of feeling or action, especially among individuals with common interests, mutual support within a group. So within the German healthcare system, this is established through wage-adjusted premiums with employers matching employee contributions. And then the United Kingdom's healthcare system, the NHS, this is established through social and private contributions that are calculated by income.
Okay, next we're going to talk about what do the European systems reveal about alternative models of capitalism. So the article goes and compares the capitalist societies with comprehensive welfare states, which are the European countries, and capitalist society with weak welfare states, which can be considered the United States. So European systems reflect differing scales of modern welfare capitalism. And a welfare state is a concept of government in which the state plays a key role in the protection and promotion of the social and economic well-being of its citizens. So these systems provide universal services to benefit all citizens, whereas countries with weak welfare states may only benefit the poor. So to compare, the United States is a traditional capitalist society where the goods and services are exchanged for money, and in the healthcare system, this is the basic fee-for-service system. And although it's called health insurance, U.S. health insurance is actually illness insurance, can be considered illness insurance. And the U.S. approach to health insurance is fragmented, uncoordinated, and just basically a patchwork of public and private programs. So overall, the system supports individualism, although the Affordable Care Act is transitioning the United States to more of a welfare-based system. And the outcomes of the United States healthcare system, the healthcare system represents 17.6% of the GDP, and personal health spending per capita is almost $6,000, and infant mortality is 6.3 per 100 live births. Comparing this to Germany's system, Germany can be considered a modern welfare capitalist society where there's corporatist coordination among social partners and high level of public support, and most Germans are covered by the system. As talked about in the paper, they set up sickness fund system where no money changes hands between the patient and the provider. This has its benefits and weaknesses. One weakness being that because Germans aren't actually the ones paying for their health care, they may overutilize the system, or they have little incentive to try to save the system money. The outcomes are better than the United States with a traditional capitalist society. Their healthcare system represents a little over 11.5% of the GDP. Personal health spending per capita is a little over $3,000, and infant mortality is way lower at 3.8. Finally, the UK, which also can be considered a modern welfare capitalist society, they have a comprehensive healthcare system. Nadia talked about the NHS. Their health and social welfare system provides for anyone who is sick, and at some point everyone in the UK is going to use this system, and it's funded through government taxes. And this system overall reflects more solidarity and social cooperation, and their outcomes are also better than the United States outcomes. They have Their healthcare represents almost 10% of their GDP. Their health spending's $2,600 per capita, and their infant mortality is almost 5 per 1,000 live births.
So when comparing the three health systems and deciding whether they consider their healthcare a cost or an investment, we decided that Germany and the United Kingdom both consider their healthcare an investment, whereas the United States considers their healthcare a cost. Some of the components that contribute to Germany making their healthcare an investment are their Krankenkassen. I'm going to say that again. Some of the components contributing to Germany making their healthcare an investment include the Krankenkassen, hospitals, physicians, and the healthcare industry. The Krankenkassen is a central risk compensation scheme which distributes money among insurance plans so that they balance out based off different patient populations. They also require that private funds offer low-cost plans for those that can't afford a normal private fund. The hospitals make their healthcare an investment because they have a fixed number of beds, they set budgets annually through negotiations, and they have reimbursements which incentivize outpatient care. They also have higher reimbursements for shorter hospital stays. The physicians make Germany's healthcare an investment because they negotiate prices for care with the insurance company, and they set spending limits for office visits, as well as they earn less if they see more patients than they were supposed to. Also, the healthcare industries have reduced pharmaceutical spending, and they use reference pricing. The United Kingdom considers their healthcare an investment through their National Health Service, NHS, as well as how they operate their hospitals and how their physicians practice. The National Health Service combines the insurance as well as the delivery of care. They've placed an emphasis on prevention early on, and the economists play a large role in their health policy. The NHS also has a large emphasis on health outcomes. The hospitals require access to specialists. They require referrals through primary care before they have access to specialists, which can offset price that the United States may spend. The physicians, specialists earn relatively the same amount as general practitioners, which can balance out the distribution of physicians across types of the field. The NHS physicians are also compensated through capitation fees. And onto the United States, which considers its healthcare a cost. They have private health insurance and HMOs. The HMOs have restricted the patient visits, and they've restricted the patients from choosing their choice of provider. There's also the Veterans Administration, which has resulted in low quality and expensive care. There's also Medicaid and Medicare, which is for individuals over 65 or with a disability. The Medicaid funding is for low-income individuals, which has resulted in high payroll tax on a pay-as-you-go plan, which is not feasible long-term. COBRA is an option for health insurance for individuals who have been laid off or have left their job. They can opt in to the current insurance they were using with their previous provider. However, they must pay an additional administrative fee, which can be really costly, especially considering a lot of people using COBRA may not be currently employed. There's also EMTALA, which has required emergency rooms to treat patients that come in and need required care, and this has resulted in an overuse of the emergency room for primary care, which is very costly to the American government. Medicare Part D plays a role in the huge cost of healthcare for the United States because of the donut hole, which leaves a large gap in between what the government pays for pharmaceuticals and what citizens must privately pay, which can become very expensive, especially for chronically ill citizens. The hospitals play a large role in the cost because they are more so becoming large, expanding health systems, and they've only recently begun to incentivize preventative care. The physicians also play a role in the cost because they have complex billing and management systems, as well as they have to gain entry into the insurance companies in order to see patients and begin a practice, which can become very costly. They also must purchase expensive liability insurance in order to cover themselves in case of an accident. The physicians also have a huge wage gap between general practitioners and specialists, which has resulted in a need for specialists in the field in order to provide primary preventative care so that we aren't having these expensive specialist treatments.
So the last question is kind of summarizing everything. Why does this seem to differ across countries? This being the investment versus the cost mentality. So there are two strategies, the push versus pull strategy. Healthcare being a cost or investment for countries is somewhat determined by these strategies. Push is basically regulations in healthcare to create better options for the consumers. And then pull is investments or incentives in healthcare to provide better healthcare for the consumer. Currently, the United States seems to struggle with this balance between the two, and that's mainly due to the foundation of the healthcare system. So, for example, the American healthcare system is complicated with many different levels and layers. On top of this, Americans seem to pay more attention to what they are receiving and the cost they are paying without really truly understanding the healthcare system itself. And then for European countries, healthcare was always established as a right from the beginning. They have a right-based healthcare system that's very simple with less administrative cost. And therefore, the consumers of the healthcare system aren't fully aware of the cost. However, they aren't using the healthcare system as much either. So in conclusion, European countries have this idea of solidarity, this moral obligation to kind of help the group as a whole through mutual support. Whereas America has a goal to support the individual with a complicated healthcare system that has a lot of cost. This kind of leads to the countries disagreeing on whether whether healthcare is a cost or if healthcare is an investment. If you have any questions regarding our project, feel free to contact us.